Doctor on Air is brought to you with the compliments of Lusaka Apex Medical University. Lusaka Apex Medical University. Knowledge and excellence.
Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health, and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. LAMU, where knowledge and excellence meet.
Good afternoon. Thank you for joining us. This is Doc on Air. Today we are focusing our attention on fertility, infertility, and fibroids. Quite packed, but we will do our best to make sure that we talk about this in the next hour and also accommodate you, our viewers, to ask the questions that you want and you need to know regarding fertility, infertility, and fibroids. I have two gentlemen in studio to help me dissect this, to help me talk about this comprehensively. I have Professor T.K. Lampert. He is one of the 8 founder members of the university that has brought us this program, Lusaka Apex Medical University. And I also have Dr. Wyson Munga. He is a consultant gynecologist. They will be helping us talk about this and also make sure that you understand it from a point of view, layman's point of view, as well as the medical and what effects it has. Gentlemen, thank you so much for coming through. How are you?
Thank you. How are you, Judith?
I'm all right, thank you. Let's start on this one. Maybe we'll start with fertility, infertility. When someone is fertile, when someone is infertile, the differentiation on that. I don't know who goes first.
I can start just briefly to say, when we say fertilization has taken place, the sperm of a man should move up to meet the ovum of a woman. When fertilization takes place, then that is the beginning of life, at inception. So, for a man to produce a sperm, I will explain, and our consultant gynecologist will take on the female side. So for a man, and even in a woman, what starts is up there in the brain. There's the hypothalamus. It's part of the brain. It's the one that triggers the pituitary to produce gonadotrophins. And those will work on the testes and on the ovaries. So testosterone will be produced. It's a sexual hormone, male hormone. And the sperms will start getting produced. And once they are produced, and then a fertile man and a fertile woman meet, then that fertilization can take place. So it's a thing that if something goes wrong in the hypothalamus or pituitary or testis level, fertilization will not be possible because sperm production will not be possible. That's where we now will be discussing during infertility part. But the sperm itself must have normal structure, normal shape, normal motility, should be able to move. When you say shape, it should have a head, body, and the tail. The head is the one that will penetrate and fertilize the ovum. The tail is the power side where it will move from the cervical end to the fallopian tube up via the uterus to go and meet the ovum to fertilize. So that's the process on our male side.
Okay, and on the female side? Dr. Munga.
Thank you first, Prof, for starting from the pituitary. So it makes life very easy for me. So the female reproductive organs or parts need to be in good shape, in good state for fertilization to take place. So there are 4 levels under the female reproductive organs that would determine whether there will be an end product, which is fertilization. So we look at the level of the cervix. The cervix is the neck of the uterus, which passes through the female, private part, isn't it? That hard, like neck, like, yeah. It feels like the tip of the nose when you touch it. So the cervix has to be okay. It has to be open, not to be too tightly closed so that the sperms can pass through. So there's a condition we call cervical stenosis, meaning it's too tightly closed sometimes where it cannot even allow the sperms to go. The second level is the womb itself, the inside of the uterus. The womb, it has to be in a good condition. The lining has to be proper, and even that opening has to be, because the way it is, the sperm that Professor was talking about has to go through this journey, pass through the cervix, pass through the inside of the womb, the uterine cavity. Then it has to continue with this journey to the fallopian tubes. It is in the fallopian tubes that the sperm is supposed to meet with the egg, which is the ovum, right? Which is the egg. Now, so I've said cervical level, then the womb level, then the fallopian tubes. They have to be nicely open to allow passage of both the sperm from down and also the egg from inside. The 4th level is the ovaries. The ovaries are the ones now that will release the eggs, or the ovum are released from the ovaries. But they enter from the end of the fallopian tube and coming this way. The sperm is coming from down. They have to meet in the tube. And once the sperm enters the ovum or the egg, then life begins. Fertility is said to exist.
So when we have a situation where, all these you've talked about, what Prof talked about and what you've talked about, Doc, they are present in both the male and the female. But then there's infertility. I know you kept repeating the word, emphasizing on good condition. I don't know if that has to do with anything when it comes to everyone is intact. They've got all these things you're talking about, but still, there's no fertility taking place. Yeah. How do we get there?
Let me start again. You follow? You follow up. So the testis must be functional. So a testis forms in the abdomen of a baby, and it must move down to the scrotum. It's a journey that takes from 10.5 weeks down to time of delivery at 8, 9 weeks. When the testis has arrived, it should properly fix in the scrotum by gobernaculum. So the testis, if you examine the testis, the position should be vertical. Now, if it hasn't arrived well, it will not fix vertically to be horizontal. That is a problem. And to make it worse, there are some children, the testes remain in the abdomen, or they are in transit, they get caught up, they don't reach the scrotum. That testis will not be functional because the temperatures, creation was such that the room for testis in the scrotum. So if it has not arrived, it will not be properly functional. And the danger is that after 20, 30 years, it turns into cancer. So good mothers, when a child is born, the elderly women, they will examine the scrotum. They want to know if the testes are there. Traditionally, they have that idea.
For the first-time mothers, what would that feel like?
The first-time mothers, that's why once they should deliver in the hospital so that the gynecologist and the midwives can help. Yeah. Yes. So, but if it is properly fixed, at puberty, it triggers from hypothalamus, pituitary, it triggers, it's a time now you are grown up. Start producing sperms, telling the testes. And the testes to start producing sperm. By the way, normally it produces the 20 to 200 million, 20 million to 200 million per ejaculation period. Those are the sperms that should now scramble to go to meet the ovum. Whichever will arrive early and is effective, it will fertilize. The rest will have no work. So it's one that they need. But production ensures normal production. Sperm count is 20 million to 200 million. But it should be of normal shape, normal movement, and then be able to penetrate. And when we say normal shape, it has to have a head, because the head is the main thing which will penetrate the ovum. The tail is the power point, which must move. What Dr. Munga said, it's a long journey from the cervix, the uterus, the fallopian tube to go and meet the ovum. So it's the male which should really move. The female just comes out with the ovary and waits for a mister to come. Thank you.
What happens externally also happens internally. Now we are seeing.
Yeah.
Let's get to the female part when it comes to issues of infertility.
Yeah.
Prof has spoken about the male side.
Yeah. So on the female side, it's not just the presence. I kept emphasizing it's the condition of these parts that determine. So for example, the cervix has to be nicely formed and nicely open to allow the sperms to pass through. So in situations where the cervix is too tightly sealed, where the sperms may fail to go in, we call it cervical stenosis. It can cause the sperms to fail to go through the cervix. At the womb level, okay, there could also be problems there. Okay, so the womb also needs to be nicely open with the inner lining of the womb. It has to be in very good condition also. Sometimes you have situations where the inner lining of the womb is either too thin, or maybe there are other abnormal growths inside the womb. That's why the issues of fibroids or polyps, you have abnormal things growing in the lining of the inner lining of the womb. That also can affect fertility. I'll come to that. And then the tubes have to be open. Remember that the egg is coming from the opposite direction, the sperm from another direction, meeting in this tube. So if the fallopian tubes are blocked, then there will be a barrier. The sperm will not be able to meet with the egg. So it's one of the commonest causes of infertility in females, tubal factor, where the tubes are blocked. Then the function of the ovaries, we said, is to have the eggs recruited and released. By the way, when a girl baby is born, they are born with the eggs already made. No new eggs are formed after you are born, but they are kept in a phase which is not active. When you reach puberty, the eggs now start being recruited, matured, and released every month. Until when all the eggs are finished, you are going towards your menopause. Even if the peas will disappear, you understand? So what I mean is that now at the ovarian level, at the level of the ovaries, the eggs have to be recruited, matured, and released. That's a process we call ovulation. So you may have good ovaries, but the eggs are not coming out, meaning you are failing to ovulate. To ovulate, it can be another cause of infertility. So at each of those 4 levels, there can be problems that may move a woman that has them looking nice if you were to look at them, but they are not properly functioning. Then it can lead to the problem of infertility.
Okay, all right. Don't forget that we are talking fertility, infertility, and fibroids. Doc on Air. We have 2 doctors with us in studio to help us talk about this. And Doc on Air has been brought to you courtesy of the Lusaka Apex Medical University. Let's go for a break. Join me on the other side as we continue this conversation.
Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. Lamu, where knowledge and excellence meet. Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. Lamu, where knowledge and excellence meet.
All right, this is Doc on Air. We're coming to you live from the Mass Media Complex. We are talking fertility, infertility, and fibroids. Before we went on that break, we were dwelling into the causes of infertility, and Dr. Munga spoke of issues of the tubal factor, ovulation. What are the other causes of infertility?
Okay, so from the female side, usually the causes of infertility are at those levels. But I wanted to emphasize one thing. If you have noticed, is that no one sex can make a pregnancy. It takes male and female. So if you've noticed, I'm speaking about the female causes, and Professor is talking about the male causes. Out there in the community, when a couple is facing a challenge of conceiving, please understand that this problem can come from either the male or the female.
Yes.
In a nutshell, we can say 30% of fertility problems, the problem can be with the female. In about 30%, the problem can be with the male. In about 30%, the problem can be contributed by both, male and female. While in about 5 to 10%, sometimes you investigate, everything looks okay. And you can't exactly pinpoint where the problem is. I thought this was very important to talk about, so that community should stop judging only one side as though they can make a pregnancy on their own. And that's the female. And males have been duped with the societal beliefs and the cultures. They don't even want to come to the hospital so that we measure their semen. If they are the problems, they are the ones with the problem. They just lump this headache and, you know,
on the woman.
Pressure on
and
the
I was
woman.
about to loop in
I just thought that
it's very important to
talk
mention
about that. So as we were talking about the female causes, be mindful of the male causes.
I was actually coming to Professor Lampert to say,
let me come in,
your causes on the male side are the ones with the issues where they don't want to go and get tested to see what could be the problem with if the 30% has been tackled.
Yes, very good, very good.
And how is the hospitals handling that?
No, the problem is that some people don't present to be examined. There's what we call hypogonadism. Now, the testes may be smaller than a normal. But until a patient presents to examine the testicular size and consistency, we wouldn't know. So what happens is that, especially those which I said have not properly fixed their vertical their vertical position is not there, they are horizontal or oblique, they tend to twist. So when there's testicular torsion, the testis gets damaged. And the people can go to hospital and they be given injections as if it's a sexually transmitted disease. But it's a torsion. And if it's missed, the testis is gone. After some months or
So
year,
correction of that is very challenging.
torsion, yes, that's killing the testis. So the other side again, because if they have not properly descended and fixed, it's possible that both of them. And then it gets another torsion, it gets twisted and it gets small, then the testicular function is gone. It can produce hormone, all right, but it can't produce a sperm. That is bad. Sometimes the mumps, a boy has missed suffering from mumps and is grown up with a youth of 30, 35. That's when he suffers mumps. The complication is otitis, testicular infection, otitis, and both testes can be damaged. There's also a tumor that occurs in the testis. It may be benign, but if the testis, you examine a patient, and the testis, they are unequal, and there's infertility, there's what we call Sertoli cell tumor. It does produce more female hormone than male hormone. So it makes the body of a patient more female, and it can't produce sperms. It's azoospermic. So we have to examine the patient. Sometimes what we talked last week, gonococcal infection, if it blocks the tubes. So there's what we call epididymal otitis, and the testis is destroyed.
Okay.
So that kind of situation, a male has to be examined. And as the consultant here said, we have to examine the sperms, because that will give us an answer.
We are hearing of this a lot of late. Is it that people are speaking out, or this situation has been with society for a while? If we have to rate, how huge is the issue of infertility?
So remember that it's a two-sided coin.
Yes, of course.
Yeah, but infertility is as huge as going up to about 15 to 20% of couples experiencing challenges of infertility. And by the way, maybe just to make life easy, what is infertility? So infertility is when two people of the opposite sex, male and female, they are having irregular regular sex, average 2 to 3 times per week, regular sex, unprotected, meaning no barrier in between, without use of any contraception, and for a period of 1 year, and there is no pregnancy, there is no conception, then that is infertility. That is very important to understand. So it is a very big problem among couples. Some choose to keep it as their own problem without coming to the health facilities to be assisted, okay? While others, have ended up divorcing because there's no pregnancy in the union, okay? And some have just ended up getting depressed because they can't conceive. It's a very huge problem.
Chances of correcting infertility?
Chances of correcting infertility depends. If the two come to the hospital, they are both examined. The chance that we'll find where the problem is and deal with the actual problem is almost 90%. 90%.
Good news.
So for females, when you come and you say, I and my partner are not able to conceive, there are certain investigations we will do. Number one, we'll do a scan. A scan, a pelvic scan, will help us to have a general look into your womb. The structure of your womb and your ovaries, do they look normal? Are there any abnormal growths in there that can affect fertility or so on? We'll also do special x-rays. Those are x-rays that will show us if the fallopian tubes are open or blocked, okay? And then we'll also do another investigation to check your hormones that are directly responsible for ovulation, for the recruitment and release of your eggs. Also other hormones that can indirectly block your ovulation. So we will run through this test. When we are done with this test, if the problem is with the female, we will 100% know where the problem is and will help you according to the problem that will be found out after we have done the screening.
Okay. If you want to be part of this conversation, get to the number that is scrolling on your screen and get talking with us if you have any questions, comments, or contribution regards fertility, infertility, and fibroids. Prof, lifestyle, food, exercise, when he talks about hormones, sometimes people don't want to go to the hospital, or in the way we live, what we eat, how we are taking care of our bodies. Does it help in regards to increasing, improving, or even maintaining fertility?
Very good.
Or maybe it's a lifestyle that will now lead you to be infertile.
In fact, you know, some traditional setup. You are married to a young lady, fertile, but you are given a period. Say, if you don't conceive in 3 months, marriage will be over. There are such statements. A piece of wood that you'll be cooking with this, by the time it finishes, you should have a pregnancy in our sister. If you don't, you are getting out of it. So that, as I said, hypothalamus. The hypothalamus is part of the brain. The panic, the anxiety, the fear that my marriage will finish if I don't conceive, I don't have a pregnancy and this wife, that makes it worse. Yes, it is very damaging to the brain hypothalamus part, and you panic, you develop failure to produce sperms. No, sex is ineffective, you know. So that is one of the problems. We must win confidence. The man must be confident, should not be punished that you must have a time period when to conceive the wife. I think that creates a problem. 2, when we are examining sperms, we don't just count a number or morphology or looking at what, they also look at pH. pH of the semen should be 7.2 to 7.8. If it is less, it's not good. If it is more, again, it will cause infertility. So there's a thorough examination. But for a man, as Dr. Munga said, for a man, we really wanted to look into all this and also take a history of sexually transmitted diseases, of ovary dangers, you know. If you are in a family, please concentrate to your family partner. If you are going all over, you exhaust the system. Then you don't have enough.
Let's get to our caller, our first caller. Hold your thought, Prof. Please hold your thought. Hello, you're through to Doc on Air. Please talk to us.
Yes, there's something I wanted to find out.
Go ahead.
Yes, I'm 45.
45.
All right.
Yeah, I'm 45. I've stopped my menstrual, so I'm just wanted to find out if it's menopause or what. And if it's menopause, is there any chance if I can conceive?
All right. You want to ask her something before she goes?
No.
All right. Thank you so much. Please hold on for your answer from Doc. All right. So she's 45. She's not getting to have her periods anymore. She doesn't know if it's menopause or not. How can she be able to tell?
Okay, so I think she asked
And if she can
questions.
conceive as well. Yes.
Yeah. So the fertility of a woman has got a life time. It's not forever. For men, even 90-year-old can, you know.
This
But
life.
for
This
females,
life.
it is limited. So for females, you can only conceive during the reproductive age, the age within which you are able to have your eggs produced and released. You understand? So as the age gets beyond 40, your fertility goes down. Remember, I said you are born with a fixed number of eggs. So every month you keep releasing the eggs. When they are finished, there's nothing you can do. So most of the females, their normal natural fertility, okay, wears off from 44 years up to 46. Usually the eggs are finished. Even in the periods that will continue after 46, usually you'll be having your P's, not necessarily to mean you have eggs that are being produced. So please, it is best for females to aim to have their children between the age of 21 up to about 35. It's the best time. After 35, it slowly goes down. Now, the other question was, is it menopause? Menopause is when you have 12 continuous months of absence of menses. Then we say you have reached full menopause. But before full menopause, there's also premenopausal phase. It can take 1 year for others, others 2 years, others even up to 5 years, where the menses become disturbed. This month they come, 2 months they are not there, sometimes they spot, you understand? So most likely at 45, most likely you may not be able to conceive. However, we do not take things literally, because there are a few women whose fertility go beyond the normal age that we expect. So there's a test that we do. We do a hormonal test called anti-Mullerian hormone. It helps us to see if the woman still has reserves of eggs in the ovaries or not. But beyond that, there are so many other things that we can do to see if she still has her fertility spared or not. But with her history of having stopped having herpes and she's 45, most likely she may not be able to conceive. The age of menopause is 45 to 55. For our women, most of them, the average is 49 to 52
so
years.
She should consider
so
how long
she's in that age where it's possible, but will not conclude for now until we get some other pieces of information on her.
She should go for that test as well.
Yes.
Professor, I'll bring you in because you're talking about exhausting when going out. But let's get our caller before we get to your point there. Hello, you're through to Doc on Air.
Hello. Now, am I through now to them?
Yes, you are through. You are through. We're talking. You're live on air, sir.
Yes, please. Now the problem with our doctors, they are just in these towns, in rural areas, don't they? So that's why he has even mentioned to say some of the marriages, they break away. When we get a doctor from maybe UTH, taken here to Kabompo and is taken to a rural area, they don't go there. So you find now these up-to-date hospitals where these doctors stay. They are very few in Zambia, if you can count them. Even here in Kabompo, I don't know if district hospital can do that. So why can't they, at least as doctors, why can't they at least maybe from the government to put these facilities even in rural areas? Thank you, please.
I appreciate it. Thank you very much.
Thank
so he's
you.
calling,
Just
calling from Kabompo.
Yeah, on Kabompo.
And I know you can't talk on behalf of the Ministry or recruitment.
No, we can't.
But
I'm happy because I was working in Kabompo myself. In 1979, I was there. It's a one of the most beautiful districts this country has.
Kabompo.
Kabompo. The meandering Kabompo River.
But you left and he's complaining, Professor.
Yeah, but when I was living there, I said, when I finish, I should go back. But he said, no, go to Kitwe Central.
So what about the doctors there? He's complaining.
No, but what I'm trying to say, that's why Apex is on to supplement government effort to produce more health workers, including doctors. And I think government will be having access to this stuff, and they may be able to man those district hospitals. Yeah. I just wanted to be excited about Kabompo Core.
It took you back to some place.
But just to speak somehow, I think almost each and every district hospital, at least there's a doctor. They may not be specialized, but there's a doctor. And now,
so Kabompo, where should he be going for him to be?
The Kabompo district hospital, there is a doctor.
Yes.
Then all the provincial hospitals now, the general hospitals, others have been upgraded to central. They have got specialists. So what usually happens, the doctor at the district hospital is able to do primary screening. Then if they feel like they need the specialist input, there's always a way of getting these things done within each province. I just thought I speak about
Very
it.
good.
Very
about
important.
that.
Very
yes.
important. Very true.
So the most important thing is going to the health facility.
Yeah.
Because the caller is talking about the rural area, but the people that are even in Lusaka, that can even be 1 kilometer from UTH or whatever, and they will fail to come
And
to
they will
present
not
such
go to-
problem. So there's also the issue of us being open about fertility and wanting help from health facilities.
Very true. This is Doc on Air. Let's go for another break. This program has been brought to you courtesy of the Lusaka Apex Medical University.
Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. Lamu, where knowledge and excellence meet.
Thank you for staying with us. This is Doc on Air.
You are talking about quality of.
Yes, when we talked about the exercise, the food, does it matter?
No,
Will it contribute?
no,
You
I
said...
was- I had said that if it's a couple, they have a family, and they want to have a child, the man should not move all over, because you really spend time, and the quality sperms may be wasted elsewhere. You must keep for the family. You understand what I mean? Because the concentration of semen.
So the concentration,
sperm,
also the one that
it's
comes
very
out
important.
first is also...
Yes, if you take it, and if it's a good quality and good concentration, it should take 15 to 30 minutes before it liquefies. That people know.
15 minutes.
So when you
let's
receive
get a
15
caller.
to 30 minutes, it should stay unliquefied, then it's good quality of sperm.
Right.
If they are too dilute, then you are not having enough to go up to the fallopian tube.
You are through to Doc on Air. How are you?
I'm fine. How are you?
Fine, thank you. Please go ahead. Talk to us.
Pardon?
Go ahead. Talk to us.
Okay. I have a problem. Hello?
Yes,
Yes,
hello.
please.
You can go ahead. We're here to listen to the problem.
Yes. I'm a married man, living in Copperbelt, Karurusha.
Good.
Yes. We had a child, a son,
Very good.
when he was 1 year too. Now my wife, she put the this what can I say? Implant.
Oh,
So now our son died. We removed it. So now it's been 2 years. We haven't conceived. Yes. So I wanted to find out this what else, what things we can do.
All right. Just hold on. Would you like to ask him something before he goes?
No.
All right. Okay. Thank you very much for sharing. Appreciate and so sorry for your loss. Please just hold on to get your answers.
Yeah, so if the woman had an implant, that's a contraceptive method that is placed under the skin. And it releases hormones slowly that go to block ovulation.
Okay.
Once you remove that implant, she should be able to to become fertile again, ovulation should be able to come back to its normal.
All right.
So implant is usually not associated with the delay of returning back to normal fertility.
So he says she's
Yes,
removed
so
in 2
what
years?
I want to say is that there's likely another problem that may not even be related to that implant. Remember, there's primary infertility and secondary infertility.
Kindly break down those for us.
Yes, primary infertility is primarily from word go. You've never been fertile. If you are a woman, you've never conceived. Okay, if you are a man, you've never been able to impregnate a woman. It means primary infertility. Secondary infertility means at the beginning, primarily you were fertile, you were able to conceive or to impregnate. Okay, then later on things change and you are not able. Fortunately, the causes are the same. So whether the problem is from the beginning or the problem came later on after you had children or you were what, you need to be investigated the same way. The factors for fertility do not change. So this couple should go to the hospital and be screened, the woman or the screenings, even in the man or the screenings. I can be able to produce today with good sperms. After 10 years, maybe something has gone wrong. I am no longer able to. So the body or the screening, the tests are the same. So I am advising them to go 2 years of failing to conceive after removal of the implant. Means there's now a secondary infertility problem that has come in. What we do not know is whether that secondary problem is in the wife or himself.
Okay.
So both need to go to be screened.
All right. Professor, what is the most common cause or reason that comes out from the male to cause infertility when you look at the patients that have come through or the pattern in Zambia for the males?
So one thing is the functionality. You see, males should know that to conceive a woman, the most effective is 1 day in a month. Why I'm saying so, if you can time when the wife will ovulate, let's give an example. If a woman ovulates every 28th of the month, just count 14 days backwards. 14 days, on the 14th day, that's the day of ovulation. And some good women may even have a feel. That's the effective day. Within those 2 days, you should have sexual contact and you have adequate quality sperms, and you'll be able to fertilize the ovum. But most of the time, it's what we call safe periods, where there's no ovum, but you are concentrating, thinking you are going to impregnate. That, I think the gynecologists, they do know this. You know, and so, in that case, I'm just trying to say, if a couple is together, that's why going outside your house to go and meet others, no, that is not necessary. You should really be within the house.
But,
no extra.
Earlier on.
So you achieve quality.
The quality.
The male quality of the sperm. But also check, as the doctor said, we should check. We can even examine the sperms as well, repeatedly. Let's look at the number of sperms, the morphology, the motility. How is it? Is there any blockage? Did you ever have sexually transmitted disease? Are you hypertensive? Are you diabetic? Because the diabetic is also known to despoil the system of reproduction.
All right. Let's accommodate another caller. You're through to Doc on Air. Talk to us. Hello? You're through to Doc on Air. We're talking fertility, infertility, and fibroids.
Yes. Good afternoon.
Good afternoon. Go ahead. We can get you.
Yeah. This is Gift calling you from Eastern Province.
Good.
Okay.
Very good.
Nkwala yawa maka?
Pardon?
Nkwala yawa ma?
That was good.
Oh my.
Oh
All right, we lost that one from the Eastern Province. Kindly move away from your TV set so that we don't have an echo. All right, we're going to have to let you go. Please, when you want to talk to us, move away from your TV set or reduce the volume because we won't have effective communication. When you were talking about when a couple gets married, they give them a wooden stick to say, when this finishes, you should have impregnated the other for the gentleman. Society has got these other, not really food, I don't know if I can call them, things that the male is given so that he becomes more masculine and he impregnates the partner faster.
The medicine.
The medicines and all those. I want you to come and comment on that, but let's go for a break. And that's the conversation we'll be getting into when we get back. The effects of those medicines in society that are deemed to make a male more fertile. This is Doc On Air.
Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. Lamu, where knowledge and excellence meet.
This is Doc On Air. Before we went for a break, Prof, I
was trying to say that, yes, there are claims of medicines. There's the brown powder, which is very common in the society. Brown powder, a teaspoon in the take. Now, that one is meant to strengthen the erection. There's also the fluid type, which should produce more fluid, more sperms. Those are claims. So what we are going to do in Rufunsa is to get those plants.
At the research center?
At the research center. We want to examine. These are traditional medicines observed by society, and they say it improves the performance, it improves the production of sperm. So we want to go and get those trees and examine them and find the correct ingredient of it, the active ingredient, and determine the dosage. Why we don't encourage this is because there's been no scientific description of what is the strength of it, how should we prescribe, what is the dosage. This is where Apex is going in Rufunsa, and it's a big research site for us.
That's a very good move. Now, when you talk about fertility and infertility, one of the causes, or is it one of the problems that also comes into this sphere, is the issue of fibroids. We hear there's a fibroid, then there's a baby growing here. Maybe we start from what are fibroids and how are they connected to pregnancy and infertility as well as fertility?
So fibroids are abnormal growths. They are non-cancerous usually. Usually non-cancerous abnormal growths of the muscles of the uterus. Okay, that's what fibroids are. They have no specific known cause.
So it's just sheer bad luck, your muscles?
No, I'm coming to that. No specific known cause. They were like mosquito bite to cause malaria. But they are risk factors. They are factors that would predispose you, that would make you to have the risk of having fibroids. Unfortunately, most of the risk factors you can't modify. Number one, race, being black. Very common in the black race and the Jews also. Okay? So you can't modify. If you are black, you are black. So they are very common by virtue of being black. The second risk factor is early age of starting to having your Ps. If you start your Ps too early, you are likely to...
And what is too early?
Too early, anything below 13. Nowadays, we are even having girls that are 9, 10 years starting to have the Ps. Why it's linked to your Ps is because fibroids grow with the support of the female hormone, estrogen. So if you come out of age too early, you'll be exposed to estrogen for many years. The other risk factor is in the families. Some families, their genes, it's like it's carried in the families, especially on the mother's side. So you find your mother, your aunt had fibroids, then you are also born with those genes. It's like it's running in the family. Again, you can't modify it. The other risk factor is late age of starting to have children. Late age of starting having
Before
children.
we get into the what is late age, let's get to our caller. You're through to Doc on Air. Talk to us. Hello?
Hello?
Yes, we can hear you.
Yes, how are you, madam?
Fine, thank you, sir. Talk to us.
Yes, I can even see the doctors there, they are doing well.
Thank you very much.
Yeah, my concern is about the fertility. The fertility, yes. Yes, my contribution is, in most cases, the problem that we have in the family, you look at the issue of someone, maybe from the childhood, is having some problems in terms of maybe where he was brought up. He had some issues on the background. For instance, someone is having syphilis and other diseases. How that can contribute to that issues concerning me? Yes.
All right. Thank you very much. I appreciate.
Thank you.
History in terms of STIs.
STIs, yes, that's what we mentioned. For females, I think the gynecologist is here. What gets damaged when there's a gonococcal infection? The fallopian tubes. As he said, the sperms must find a passage to go up to fertilize. But if there's a repeated gonococcal infection in a female, the fallopian tubes are poorly treated. Yeah, when healing, they close up. So there's no room for the sperm to pass through.
Okay.
That causes infertility.
Okay, all right. You're winding up on some of the, before we went to our caller, you were talking about fibroids and some of them and how they just pan out in regards to fertility.
Yeah, maybe delayed age of starting to have children. Usually we used to use the age of 30, but now it's even lowered. Okay, there are many others, but I'm looking at the time. So unless if you allow me to talk about how fibroids can be linked to infertility. Okay.
Yes.
So fibroids can affect fertility in two ways. Number one, the fibroids can grow on the muscles of the uterus near where the tubes are entering the uterus. So the fibroids can cause blockage by creating pressure and pressing on the fallopian tubes as they are entering the womb. So you can have tubes that are blocked because there are fibroids that are pressing and blocking the tubes. That's how fibroids can cause infertility. Second way is where the fibroids can grow and affect the inner lining of the womb. When the egg is fertilized, it's supposed to move down from the tube into the womb and attach itself, what we call implantation, the fertilized egg. Now, if the fertilized egg implants on a fibroid growth, a fibroid mass, it will fail to implant properly, so you can have early pregnancy losses. It's a huge topic.
We surely need part two of this one. So Lusaka Apex Medical University, as I look at you. This has been Doc on Air. We have been talking fertility, infertility, and fibroids. A big thank you to the two gentlemen who are in studio to help us discuss this. Dr. Wyson Munga, he's a consultant gynecologist, and Professor Tike Lampert, one of the 8 founder members from the Lusaka Apex Medical University, the ones who have made this program possible. Thank you so much for joining us. Join us again next week on a Sunday for more information regards your health.
Doctor on Air was brought to you with the compliments of Lusaka Apex Medical University. Lusaka Apex Medical University. Knowledge and excellence.